donation is a thing that seems to go unnoticed for us on a day-to-day basis. For me, on the other hand, it is something that I will always be grateful for. When I was 3, my dad was diagnosed with polycystic kidney disease, and he received his first transplant in 2000 after being on the organ donation list for 2.5 years. When I was 10, his kidney failed again, and he was put back on the transplant list and received another kidney about 3 years later, which saved his life. Almost everyone in this room is healthy and has functioning organs. Since we are healthy, it is easy to forget about those that are in need of organs. There are currently 119,939 people who need a life-saving organ transplant. According to Buffalo University, 11% of students surveyed at 2 universities in New York State have formally declared their intentions to become organ donors. Interestingly enough, 80% of the students surveyed said that they would like to learn more about organ donation. I have been impacted by organ donation and have done a lot of research on the topic. I hope to help you understand the importance of becoming an organ donor. So let's talk about some of the problems and how to fix them. Currently, there are 324 million people living in the United States. According to Donate Life, 95% of people support organ donation, but only 48% of people are registered. Half of 324 million sounds like a lot, but when only 3 out of every 1,000 deaths results in a way that allows for organ donation, that narrows the number significantly. Unfortunately, this is causing an average of 22 people per day to die while waiting for an organ transplant, according to Donate Life. A recent study has shown that people are reluctant to sign up because of medical drama shows like Grey's Anatomy. People begin to think that the medical advice on the shows are real and reliable, and this has led them to believe that doctors are dishonest. In a frequently asked questions article Vanderbilt Hospital released, they reminded people that they will receive the same level of care whether or not they are registered to donate organs. Another problem is that there isn't enough awareness. Most of us are asked when we go to the DMV if we'd like to sign up, and that's all we hear about it. We generally aren't given any information about organ donation, so people don't understand what they're signing up for. Vanderbilt also says that signing up to be an organ donor on your driver's license isn't enough. If you are in a fatal car accident and your ID is lost, when your family is unexpectedly approached about donating your organs, they are more likely to say no. Because of the lack of awareness, I think a great solution is to put ads on social media. This is a great way to reach out to lots of people in a timely manner. Another way is to inform people through school. In high school, most teens take a class about wellness or health. In this class, they can have a guest speaker and an opportunity to sign up if they're over 18. College campuses also require all of their freshmen to take a specific class. At MTSU, it is University 1010. They could also have a guest speaker and present opportunities for them to sign up to be organ donors. Now you are aware of some of the issues and causes about organ donation. Almost everyone in the U.S. supports it, but less than half are actually signed up. Some people haven't signed up because they don't trust doctors, and others don't know enough about it. Signing up to be an organ donor can save up to 8 lives. Signing up is easy, and I will have my laptop available if you'd like to register. We have the ability to save lives after we have died, and that is an opportunity we shouldn't give up. Thanks, guys.